services, and I've been in that practice since 2008, and I've been in the mental health field since 1991. So I've had a wide variety of opportunities to spend time with individuals in multiple situations, sometimes domestic violence and group homes and depression, anxiety, and it runs the gamut. It starts early on, actually. Oftentimes during the initial years when they're first becoming toddlers and entering into the preschool years, they're starting to understand their level of attachment to family. Sometimes when they're having maybe an insecure attachment or they're having a difficult time separating, this is where we start to first see some confidence issues. Usually the preschool, kindergarten age is where you start to see more of the social confidence show up, and sometimes they're having difficulties around that age just because they're not sure how to deal with themselves. Part of our job as adults, parents, teachers, counselors, people in the community is to be able to help the kids learn how to understand themselves so they're better able to understand the world. And because they're oftentimes in new situations, they're brand new, they're unpredictable situations that they may not have ever experienced before. So sometimes what needs to happen is us as the adults coaching them and helping them to understand, maybe through their personality or maybe their temperament, how to adapt to those circumstances. Social kids oftentimes are going to be a little more out there, risk-taking, adventurous, trying to just experience their life. Some of the more reserved kids are taking it all in, maybe observing the world and trying to have more of a slower approach to figure out how they're going to adapt to those circumstances. So having that knowledge, you could have a family full of different personality types, and if one personality type isn't quite understanding how the other personality type understands the world, then there could be the conflict. And oftentimes the conflict can start to lead to lower confidence. Resistance, sometimes resistance to complying with something or resistance to a new situation, easily frustrated. And some of these signs come out in behavioral or emotional ways. Some kids might back away from things, break eye contact. Some may be more aggressive in their nature and throwing of the tantrums. Even older kids, 5, 6, 7 years old. Sometimes we expect that with the 2 and 3-year-olds, but if they start getting older and they're resisting, and maybe with homework that's being assigned and they're ripping up their paper or just frustrated and throwing down a pencil and just starting to explain without words that this is too much. I'm not sure how to handle the situation. Praise is always a good one. Being able to look for the positives and being able to see the areas that they're making effort in and trying. Also validating their experience, and that's really important for all of us, no matter what age, but being able to understand that sometimes it's a rough time, learning something new, being in an unpredictable situation, and being validated by the others around, maybe the ones who are in charge or have a little bit more control over the situation. For instance, like a teacher in a classroom who's giving an assignment, if they're able to really acknowledge, yes, I see this is difficult for you, you're learning it for the first time, and look at all that effort that you're making. At home, same thing, kids picking up toys or learning a new skill there, maybe a chore, or even a new sibling coming into the home and being able to learn how to become a sibling, and that's all new. Or even family members coming to visit. And so these are some things that as parents we can encourage them, just acknowledge them and meet them where they're at. There's going to be the non-negotiables in life with the kids where the parents still have the authority, but being able to offer them choice, maybe a choice through time, are you going to do this now, or do you want to do this in 10 minutes from now, if it's reasonable, if it's something that's workable. And so identifying as an adult what is negotiable, and then following through with that. The follow-through is important because all too often if there is a no, temper tantrum, escalation, it's very taxing sometimes for the parents emotionally, so then oftentimes it can either give in or it turns into a bigger power struggle, and that's going to lower confidence too. Oftentimes when we're looking at disruption in the home, there may be whining and crying and things like this, but if there's too much disruption in the home consistently, that's definitely a sign. But there are many resources out there through self-help. There are many books, there's websites, there are a lot of even YouTube videos, and all of these are very helpful. and being able to apply them at home, and that's the hard part generally, is putting things into practice. So being consistent with the method that you're trying, even if it was something like implementing a chart system at home so the kids are aware of what it is that you're trying to do, and then it keeps you on track also. A lot of counselors will do a consultation just to see if it's a good fit, because with kids, the relationship is very important. You want to be able to have a good rapport with the child and help them to feel comfortable in their environment, and that's going to lead to a lot of successes. They can call their health care insurance to see if there's a provider who's listed as a child therapist, or of course the website is a good resource, and sometimes word of mouth. If you know friends or family friends that the children have gone to counseling, sometimes just connecting with them and saying, hey, what was your experience, and can I have their number? And so oftentimes that piece is really helpful for parents. It is a relief, it's another resource, and can help the kid feel like they're available to speak their mind and express themselves and feel confident about themselves even in the counseling session. Well, with kids, there's oftentimes play therapy. There's interaction. It's very interactive with kids because sitting down and doing a 50 or 60 minute session of talk therapy doesn't oftentimes work well with young kids, especially if they have maybe an attention or hyperactivity problem. So being interactive, meeting them again at their level, and being able to try to help them express in their way. And also, if it is a family session, being able to engage the family, because so much of it is educational for the family as a whole, being able to help understand the dynamics of the family, why it is that way. But also there's different forms. So say if it's something traumatic, it's called eye movement desensitization and reprocessing, EMDR, and that would be more one-on-one to help them process through trauma that they might have dealt with. So there's different methods that families or children can have in a counseling session. Sometimes it's more about relaxation, learning, developing physiological self-soothing techniques, and sometimes it's more about emotion management and helping them to learn what a feeling is and how to express it or how to diffuse it in some way, especially if it's a negative emotion. Sometimes the positive emotions are so big that we have to teach them how to learn to contain that positive emotion so they're able to sit still or focus again. And so some of the sessions can be very fun and very interactive. So with kids, a lot of times they'll respond pretty well with therapy.